you in this room have something they don't like about themselves. For most of us, it's easy to find something we don't like, but not something that affects our day-to-day lives. Body dysmorphic disorder is a complex disorder that deals with the obsession of a minor flaw or an imagination of a flaw affecting day-to-day life. The development of body dysmorphic disorder, or BDD, has different factors that may affect one differently than another, whether it involves a social setting or obsessing in front of a mirror for hours. Diagnosis for body dysmorphic disorder is constantly improving, but every situation is different and can affect one's life more than others. First, I'm going to tell you about the evolution of body dysmorphic disorder. BDD, also known as dysmorphobia, is a common affliction affecting 1.7% to 2.4% of the population, with roughly equal distribution among men and women. It can happen to pretty people, it can happen to people who are average looking. Dr. Fessner says, a professor of psychiatry at UCLA, has conducted studies on the condition. Social media also plays a big role when it comes to body dysmorphic disorder because they are constantly comparing themselves to others. Numerous people say that social media is blamed for all insecurities, especially in young teens. When scrolling through our feed on Instagram, Twitter, Facebook, and other sites, we are exposed to a highly curated selection of photos, images, and snaps that are far from our reality. According to Matthew Schulman, a plastic surgeon in New York, says he has patients that have been coming in with Snapchat-filtered selfies to show what they want done to their body. This constant exposure leads to unhealthy pressure to achieve unrealistic body types, which can lead to body dysmorphic disorder. This is especially common for teens because they are typically battling from insecurity and depression at this age, and having the media given them certain expectations to be curvy, sexy, thin, etc., which doesn't help at all. Lastly, magazines and evolution. Body dysmorphic disorder typically starts with comparing themselves to others and then turns into seeing their body as different than what it actually is. Social media platforms change is responsible for the disconnect of mind and body. Social media turned into the posting of filters, quality, etc., more than just the fun and entertainment that we used to use it for, which makes those suffering with the disorder that changing their appearance is okay while battling a disease. Social media isn't the only problem with the disease. Magazines are another form of media that shows photoshopped models, and neglecting all body types makes this disease really hard. According to the Lexington Line, 80% of women say that the images of women on television and in movies, fashion magazines, and advertising makes them feel insecure, and 42% of girls in 1st to 3rd grade want to be thinner. Although the media greatly contributes to BDD, there are factors that are to blame for the obsessiveness with falls and perception. Some signs and symptoms of BDD. Those who suffer BDD often commonly have other disorders such as social anxiety, depression, eating disorders, or obsessive compulsive disorder. According to Alice Atkins from the Lexington Line, to truly understand someone who suffers the symptoms from body dysmorphia is crucial to acknowledge the patient from birth to present. Social context for the disease began with self-esteem in the family, so it is important if this is something in your blood, so you can know for the warning signs. BDD is more closely related to social phobia, OCD, or depression than most of the other somatoform disorders. Individuals with body dysmorphic disorder cannot control their negative thoughts and are always wanting to change themselves. They constantly are looking in the mirror or making negative comments about themselves. Sometimes the disorder leads to hospitalization due to suicidal thoughts in worst cases. Some patients in desperation try to do their own surgery by attempting a facelift with a staple gun or trying to replace nose cartilage with chicken cartilage in the desired shape. Individuals with BDD thoughts may cause severe emotional distress and interfere with their daily functioning. They may miss work or school, avoid social situations, and isolate themselves even from family and friends because they fear others will notice their flaws. BDD can also be misdiagnosed as one of those disorders because they share similar symptoms. The intrusive thoughts and repetitive behaviors exhibited in BDD are similar to the obsessions and compulsions